Hi, my name's Kayla. I'm going to be performing wound care and dressing change skills video. So first, I would perform hand hygiene, enter the patient's room, introduce myself. My name's Kayla. I'm going to be your nurse today, and I'm going to be doing wound care and dressing change. Next, I would provide privacy. I would use two identifiers, ask the patient for their name and date of birth, and check their wristband. Next, I would start with removing the old dressing. So I'm going to, my hands are already, I did hand hygiene. We're going to put clean gloves on. And we're going to make sure they fit properly. And we're going to go ahead and remove the old dressing. I need to move this around so it's easier for viewing. So we'll remove it, and we want to remove it parallel to the wound. We don't want to pull, so I'm going to go around the outer edges. And I would observe the old dressing, place it in the biohazard bag. And I would remove my gloves. Place them in the biohazard bag. Next, I would open up my kit. And I'm only touching the outer border. Make sure they fit properly. And now we're going to go ahead and clean the wound. By the way, this is going to be my dirty hand. This is the clean hand that we're working with. So I'm going to place everything in this hand. And once again, I'm actually going to move the camera so it's better easier to see. So I would work my way closest to the wound and then outer, but I would use a new swab for each motion. I would place this in the biohazard bag. Next, we're going to dry the wound. And I would use this gauze here. And we're just going to pat, again, closer, starting from closest to the wound, working our way outward. And I would use a new gauze for each motion. This is going to go in the biohazard bag. Next, we're going to palpate the wound. And I'm looking for a tissue type, odor, color, and this is when I would measure if indicated. Now I'm going to apply the transparent dressing. Unfortunately, I used it for the last video, so it got really stuck and I had no means of getting a new transparent dressing. So what I would do is I would take the plastic off, apply it to my wound, and there's a paper border that I could remove, and there's a spot on the transparent dressing where I could initial and place the date and time, and that wraps up our dressing change. So I'm going to remove, actually we would throw everything in our biohazard bag. I can remove my gloves. Place them in the biohazard bag. Perform hand hygiene. Make sure my patient is in a comfortable position and let them know I'm now going to document what I did.